There you go. Hey, Rebecca, I love you straight up for all you do for us. What specifically people with autoimmune disease more susceptible to your Hashimoto disease here? Yeah, you got to be careful. If you have autoimmune disease, if you're taking a steroid chronically that lowers your immune system, you got to be real careful. Obviously, you're at higher risk. Rosalinda, love you too, man. Sorry. Sheep are just fine. Thank you. Hey, Mary Luz. Hey, everybody click follow Mary Luz Acosta. She makes the most amazing dishes. She does little cooking demonstrations, has pictures, really healthy stuff. That'd be great for you. You want to get healthy? You want to try to avoid coronavirus? Like, start eating healthy. Start with food. All right. Hi, Mama Bear. Do you expect a huge second wave, and what's your take on children's risk too? Mama Bear, Aaron, I appreciate that question. I do expect a huge second wave, and actually I'm going to talk about that in the next few days. It's going to be much worse, mostly due to our own actions, but you'll see. We'll talk about that. Okay. And children are not at risk. Don't believe this inflammatory Kawasaki disease, etc. Kawasaki disease is well known. It's well studied. We studied in med school. We studied in residency. It's inflammation of the medium-sized vessels. It's nothing new, right? And there just happened to have a few pediatric patients who are showing up in New York with this sort of stuff. And I know that it's might be spreading to other places, but we're on alert. It's not widespread. It's still much more prevalent for the obese population, older population, smokers, lung issues, etc. Right? And go from there. Can't stop rate of growth. I don't know what your question is. Sorry, hon. JJ, nobody knows what the actual death rate is because Democrats are inflating the numbers. Oh, God, go away. Megan, what do you think of the CDC guidelines for school? Honestly, that gets a little political. I haven't really read the CDC guidelines for schools in particular. And I will say that our kids aren't really the ones at risk for catching the disease. Yes, a few young people have gotten it, but they're more of a transmission vector. They bring it home to elderly grandparents. It's the elderly school teacher, the professors that are at most risk, the janitorial staff, etc., that are compromised. So, schools are under a challenge. They are definitely going to have smaller class sizes. Honestly, like we have become so comfortable with remote learning now. I think there will be a new thing about remote learning. Okay. What about vitamin D? Vitamin D is super important for your overall health. It has a lot of benefits, but the precursor to vitamin D is even more important: sunshine. You got to really get a lot of sunshine, which is good for us in the US and Canada because we're going into summertime. So we have lots of sunshine ahead of us in Europe and such. Now, a little bit more worried about our Southern Hemisphere people like Australia, New Zealand, who are South Africa as such, who are heading into winter. So they might see a really bad surge. We're not sure yet. New Zealand's done a good job of keeping the numbers down, and as well as Australia, but we have to wait and see. All right. Should my 70-year-old realize fear going to doctor for wellness appointment? Man, a lot of doctors have started going to online visits, virtual visits. My guess is your 77-year-old doctor offers something like that. And so it really is going to depend on what level of care they need, what sort of, how much they need. What's a good dose for zinc? Nancy Bishop, what's up, girl? I wouldn't go crazy on the zinc. Zinc's, a mineral that's is a trace element that we need for several functions in our body. The whole big thing about zinc right now that is a surge. It goes around the hydroxychloroquine rage from a couple months ago, and we know that the hydroxychloroquine doesn't work. Which you can go back, look at my videos. I have a video that says I don't understand what's the big thing about the hydroxychloroquine, and in my understanding, it shouldn't work. So zinc is supposed to augment the function of hydroxychloroquine. Hey, Alex, what's up, buddy? Dr. V, is weight loss surgery not safe to do right now because of COVID? This is probably a good question to maybe end the broadcast on. I don't know how long I want to go. This is really a question for actively practicing surgeons and programs and communities, right? So obviously in hard hit communities like New York City, they're not doing elective cases yet. In some cities, I know I have a couple of good friends, Dr. Helmuth Billy, who might watch this later, and Dr. Terry Simpson, who are in California. They're both great bariatric surgeons, good friends of mine. And their hospital has opened up to start doing bariatric surgery. My friend I'm in Houston, Texas right now. My friend in Tyler, Texas has just started doing bypasses again. So a lot of it's going to depend on how hard hit was your community, how many cases did that hospital have, are there still active cases in the hospital or not active cases in the hospital. But I will tell you that most programs for sure have increased their precautions, and pretty much every elective surgery now, they are requiring patients to go test for coronavirus. So even if you're having a gallbladder removed or hernia surgery or elective procedure, even a colonoscopy, they're requiring patients to have coronavirus tests. So be prepared for that. Jacqueline Diaz, antibody testing, how accurate? Yeah, not so good just yet, and we still have some issues that they're working through. I wouldn't right now. It's too early to hang any sort of conclusions on antibody testing. So, great question. Sharon, does using a CPAP machine increase your risk? It doesn't increase your risk. It just means that you obviously have sleep apnea, which is a pulmonary function, right? So a lung function. If you catch it, you have increased chance of worse outcomes because maybe you don't have the lung reserve. So be careful. Take a lot of precautions. All right. Thank you. Here you go. So Susan, yes, I had to have the COVID-19 test before my pacemaker procedure. Good luck on your pacemaker procedure. I hope everything turned out well. Lisa Irwin, what do you got to say, girl? Cute picture. I went to the PCP here in Arizona. They took our temperature at the door and only let patients in with no other people. I'm going to tell you about the whole temperature thing. I'll do some other videos. So if you're liking these coronavirus videos, I'm going to do probably one every other day. But I'm going to tell you, I think the temperature taking thing is really kind of dumb. Because if you got fever, one, it could be fever from a lot of things. Doesn't have to be from coronavirus. So it's non-specific. And then two, if you do have a fever from coronavirus, then you're probably already infected a shit ton of people. And number three, coronavirus doesn't really spike fever that much. And that's also another rumor lie. I don't know anything about Godinsil. Oops, here we go. How do you see recovery from COVID-19 in the Houston metro area? We're doing better than Chicago. Houston's the fourth largest city. Chicago is the third, and Chicago's on fire. Houston's doing pretty good. Give it time, Goldie Con. Texas Sunshine is helping. It's the numbers are coming down. We'll be all right. So Shelly Smith, the NAC supplement, there's really no good data on that. Oh, I knew it. See, Doc Simpson. So if you take temperature and ask a few questions, you have a better sensitivity than PCR test. Interesting, buddy. I think it goes back, and I think Doc would agree with me. It is, the history and physical, right? History and physical. This is what I was trying to say. It's sensitive, but not specific. That's exactly right. Taking the temperature. What does weed do to your lungs? If you don't know, you shouldn't be smoking. All right. Waffles. I find your videos very informative. You should do more. Thank you, buddy. Appreciate that. Check you next time, Doc. We'll watch in a bit. Thanks, Eric. Thanks for watching. All right. Yeah. Hey, Gordon Raphael. What's up? Look at you looking all like that. What about lupus and COVID? I think it goes back to what medicines are you taking? How well controlled is your lupus? Are you taking prednisone? Are you on a big steroid dose, which we all know will lower your immunity? So, can you give a few examples of how a second wave will be worse? It's going to be worse. It's going to be a lot worse. And it's going to have more cases, more deaths. And that's my next video in a couple of days. How will the number look like in August? The current mathematical models has us in the United States about 140,000 to 150,000 deaths currently. So, Tess, thank you for your update, Dr. P. Thank you, Tess. All right. Vitiligo and COVID risk? Probably not. Probably not. Unless again you're on one of these medicines for your vitiligo that lowers your immune system. So you got to be careful about that too. All right. Oh, here you go. No spleen. Yeah, here we go. Oops. Here we go. Yeah, as you know, your spleen functions in your immune system. So if you don't have a spleen, you're at risk for all sorts of infections, right? All right. Man, homeschooling, you should look into it. There's really no reason really to go to school anymore. It was an archaic system created out of the Industrial Revolution to create educated workers. I've talked about that. Hey, Francis, long time. Great to see you. Run with your passion. Enjoyed our time at Loveless. You don't even look at this. That can't be is that you? It's just talking about you always remember your great advice. Naturally feel hungry, so unnatural feel. Thank you. Thank you, sweetheart. Hey, look at that. Are you married? So cute, knowledgeable as fuck. I like you because you said ASF. No, but I have a long-term girlfriend. What about kidney disease and dialysis patients? Danielle, man, that's a good question. With kidney disease, there's often other comorbidities. Most patients with just kidney disease don't have just kidney disease. A lot of times they'll have high blood pressure because your kidneys function a lot with your kidney disease, your blood pressure. And you know what I'm saying. Your kidneys control and help regulate your blood pressure. That's what I'm trying to say. So a lot of patients with kidney disease will have hypertension. A lot of them will have diabetes, and that might have caused the kidney failure. A lot of them will have autoimmune diseases like lupus, for example, and inflammatory diseases. So usually, especially if they're end stage, by that I mean they're on dialysis now, then they're already immunocompromised and they have comorbidities, which absolutely puts them at higher risk for sure. What do you think of the racial and blood type differences in outcomes? I think it's too early to really say. Things are changing. It'll be interesting to see if there's any benefit from blood types for sure. Avery, what about amusement parks? Is it reckless to be open? Again, it's the same thing. We're going to have to be social distancing. The heat will help, the metal. I mean, if you ever... Man, last 2 summers ago, I went to Orlando, June, to Disney World, and dang, it was hot. It was hot. But, dude, it was crowded. You got these long lines. You got to be really, really careful. So, all right. Anyone want to give me a compliment real quick? And I'll... There we go. Hey, Nora, thank you for what you do. You're as cool as fuck. And with that, that's the best way to end a Dr. V broadcast, an F-bomb. All right. Love you guys very much. Stay safe out there. Best wishes to our frontline doctors, nurses, our techs and assistants and venipuncture people, even our front desk people who are signing people in, they're scared too. So, and I get it. We're all scared at this time. And the most we can do, the best we can do, is take precautions. Try to limit your exposure, not for yourself, but for the other person, right? Wear the mask. I know it looks silly. It's inconvenient. It's not going to help you from catching it, but it might do a little to help spread it and at least keep you safe, keep the other person safe. So you do it for me, I'll do it for you. Wash your hands, have a lot of cloths wiped down, and take care of our elderly. Take care of those at most risk. And for those of you who wondering why a bariatric surgeon is doing coronavirus video, I'll say it one more fucking time. It's my peeps. They're my peeps. They're the people at the most risk, the morbidly obese, and the best thing that they did for themselves was to lose the weight. The best thing they did for themselves to decrease their risk from coronavirus was to lose the weight. So if you think a bariatric surgeon shouldn't be talking about coronavirus, fuck off. Bye, guys.